Is there any chance that this can resolve spontaneously?
So that's the craziest part of this thing. We have heart flaccid for 1 year, 3 years, 5 years. This idea of the sprouting is making more sense as the real explanation for this, because once it sprouts, I don't know how you're supposed to stop that.
How do they
It's
do it?
typically after prolonged masturbation, injury during jelqing, or injury during intercourse, or it's something is causing excess information to go from the penis through the pelvis perineum into the caudate, activating the sympathetic preganglionic, the ganglion, the postganglion, and that nerve is just firing. I think that's the vast majority of cases, rarely the back, where a herniated disc or interlo cyst can do this. Maybe a little more commonly than the caudate is region 2, bicycle injuries, straddle injuries, falls onto the perineum.
That's very interesting. I get a lot of comments from my viewers, and I have seen 2 cases, and actually I've seen a case the day before. Now, yesterday I saw a case.
Hundreds of cases are in communication with.
Yes.
It's just awful.
What pops up time and again is vacuum pumps. So the case I saw yesterday, he was perfectly fine, and he described it to me that he was having a great sex life. On April 16, he tried a vacuum pump. Yes.
Right?
And he tried a vacuum pump 3 times on an erect penis. The next day, he didn't have any erection. So he has to stimulate himself to stay erect.
Yeah.
His orgasms are weaker, they're shorter. I gave him a very good examination, so there's nothing wrong with his neuro status. Everything was fine. Ultrasound was fine on the penis, everything. So my idea was, could this be heart flaccid syndrome, even though the penis wasn't like in the typical symptoms that you described, but he was feeling it was cold, it was numb, stuff like that?
Yes, but we lack an official diagnostic schema to define heart flaccid. In our office, we take ultrasound gel and we put it in the refrigerator, so it comes out really cold. And we induce heart flaccid by using the cold application. We're also using, there's a device called Rigid Scan, which we use typically in the erect state, but it can go along the hard flaccid, and when it squeezes, you see hardness of the penis. So we can actually visualize the hard of the hard flaccid state by the squeeze of the Rigid Scan loop. Shows rigidity. I mean, normally in the flaccid state, there's no rigidity. This is the most fascinating part of hard flaccid. In the field of men's sexual health, sexual dysfunctions are typically occurring in the erect state. Erectile dysfunction, difficulty orgasming, Peyronie's disease. I mean, the litany of conditions are defined in the erect state. So physicians and providers are commonly hearing sexual dysfunctions in the erect state. And most providers ignore heart flaccid because it's not a condition in the erect state. We have to rethink that men's sexual problems can also occur, in the flaccid state. And I think that's going to take a little time because providers are very insensitive to hard flaccid. But they get the, oh God, go away. There's nothing wrong with you. You can still get erections.
Absolutely.
Because it doesn't affect the parasympathetic systems in the majority of patients. Although if you injure yourself with a vacuum device, you could theoretically injure both systems.
This is what I was thinking, because we have the orgasm part and the erection part, so it's got to be something with the connected.
So they've done an animal model, which I think is kind of interesting. They've done an animal model where they hurt the sciatic nerve. So they did some lesion to the sciatic nerve, and then they looked at the sympathetic system, and they found nerve sprouting, excess sympathetic fibers in the sympathetic system as a result of injury to the somatic sciatic nerve. So if you want to broaden that sort of model, if you hurt the dorsal nerve, the skin nerve of the branch of the pudendal with a vacuum device or jelqing or prolonged masturbation, prolonged intercourse, something, you can get sprouting, theoretically based on the model, of sympathetic nerves, and then you get this hyperactivity of the sympathetic system. I don't even know what you're supposed to do under that situation because they're just firing.
Okay, but we are here at a very important Shockwave Congress, right?
Yes.
And you wrote an article that I'm citing to my patients all the time. It's titled, Also, zebras need
Yes.
therapy. I get lots of calls from patients who think they have hard flaccid syndrome. So I take them in, I do a thorough examination and a thorough history just to find out, is this anything connected?
I mean, the classic thing is to just stand up, gloves, thumb and index finger, and we take photographs of the penis in the stand-up state, and it's really shrunk. You can see the veins, you can see the kind of like vaginal rugae of the skin. And when you take your thumb and index finger, it's firm. I mean, it's ridiculously firm. We need a lot of research in hard flaccid. And so I've injected, if we think it's excess sympathetic activity, then injecting a drug that influences norepinephrine is being released into the erectile tube. So if you think of your skin on your forehead and you want to contract it, you can get wrinkles. So to counter that, Botox into the skin will help prevent the contraction. So a very logical conclusion for hard flaccid is to take Botox and not inject it in the skin of the penis, but directly intracavernosally to negatively influence the ability of the sympathetic system to contract. So I've done this on a few occasions. It hasn't helped at all.
Okay.
So it's really sad because it's things that we're trying to think logically and rationally, and these poor people are suffering, and we haven't yet found the home run.
What about shockwaves?
Of how to manage them. So I've done a whole bunch of shockwave, and some people, I must say, it's somewhat helpful. It's not the home run that I'm hoping for, I must say. I haven't found the home run. We have successfully treated hard flaccid when it involves a cauda equina pathology. They will have hard flaccid symptoms, but they also may have sciatica symptoms, pain shooting down the leg, and classic of a herniated disc annular tear situation. But the usual scenario is injury to the penis, and they don't have sciatica, and we're struggling with helping these people.
Is there any chance that this can resolve spontaneously?
So that's the craziest part of this thing. We have hard flaccid for 1 year, 3 years, 5 years. This idea of the sprouting is making more sense as the real explanation for this, because once it sprouts, I don't know how you're supposed to stop that. So we have a lot of work to do.
Yeah.
We'll find it. I'm very convinced. We're like bulldogs. We just keep at this. Thank you.